Okay, we are live on YouTube, and I'm going to hand over to Stefaan Verhulst and his three panelists for the opening plenary. Thank you very much, Stefaan.
Thanks so much, Emily, and thanks so much, Zeynep, for inviting me and also for, again, organizing this wonderful event. And as you already indicated, Emily, my name is Stefaan Verhulst. I'm the co-founder of GovLab, or Governance Laboratory, here in New York. We are part of New York University. And in addition to that, I'm also, together with Zeynep and with John Crowcroft, an editor-in-chief of the Data and Policy, which, as Zeynep has alluded to, is the journal that is associated with Data for Policy, but also, of course, anyway, has a broader focus beyond some of the elements that we will discuss in the conference. It's my real pleasure to be back here and to indeed join the 6th Data for Policy conference, which has become kind of a milestone in our field with regard to reflecting on what's the role for data for policy, and also what's the, anyway, how does data inform policy, but how does policy inform data? And when the international committee that organizes the conference was thinking about what should be, anyway, the main theme, it felt obvious that one of the main themes that we wanted to explore, and which also informs the opening plenary, is the theme that dominates still our lives, even 18 months or more after, of course, we all were confronted with the pandemic. And so this opening plenary, together with, of course, a lot of the other sessions that will follow, will take a distinctive look at what role did data play as it relates to COVID-19. Now, COVID-19, for all of you, has been very impactful in many cases. It has been, anyway, devastating with regard to both, anyway, losing friends and family, but also with regard to losing jobs and looking into, anyway, how our environment is changing as a result of the pandemic. But to a large extent, it also has been a watershed moment with regard to how data can be used in order to rapid respond to a very dynamic threat such as COVID-19. And so I've invited 3 people today to join to share their experiences and their wisdom with regard to what is the new normal of data as it relates to COVID-19. And I have the pleasure to invite Chinwe, Brennan, and Chris to join me in this panel, and invited Chinwe, Brennan, and Chris because they bring 3 distinctive perspectives to the topic of the role and the potential and the challenges of using data to address and to respond to a dynamic threat such as the pandemic or COVID-19 specifically. Chinwe, and I will ask each of the participants and the panelists to introduce themselves in a second. But I think I've asked Dr. Chinwe Ochu, especially given the fact that, of course, anyway, a lot of the focus has been on the role of data for public health and population health. And I think Dr. Chinwe has been at the forefront of using data to respond to the pandemic. And I'm sure we will learn about, anyway, what that meant in practice, and also are there some lessons learned moving forward for this community and the community at large to build upon as a new foundation with regard to the role of data. And then Brennan Lake I've invited because one key element and really an interesting development that we have noticed is that indeed those that have data, such as private corporations, have become a critical data provider as it relates to informing policies. And Brennan has been a pioneer in the whole data for policy or data for good space. And eager, and thanks, Brennan, for joining. And I will ask you in a second to give a little bit more context on what I mean. I just try to, anyway, set up the stage here to at least have an understanding on anyway, how this panel is being organized. And then last but not least, I've asked Chris Wiggins to join as well, not only because Chris is anyway one of the most important scholars in data science, and especially as it relates to anyway the use of data in the public interest, but also, of course, is the chief data scientist at the New York Times. And I think one of the key, again, areas that I feel was interesting and is interesting as a result of COVID-19 is how media organizations such as the New York Times have become key data analysts, and also, of course, have used data for their own operations in order to inform how they can respond to a dynamic environment such as COVID-19 as well. And so we will hear from three distinctive perspectives: the public policy perspective, the private sector perspective, and then the academic and media perspective as well, on what is the role, what has been the role, and what will be the role moving forward of data as it relates to policy and pandemics. So with that, over to you, Chinwe, for a short introduction. So I will ask each panelist to introduce themselves, and then we will go straight into some of the questions that hopefully will anyway cover a broad area of data for COVID-19. Over to you, Chinwe.
Thank you very much, Stefan. And good morning, good afternoon, good evening, everyone, whichever part of the world you're joining us from. I'm Chinwe Ochu. I'm a medical doctor and a public health specialist. I work with the Nigeria Center for Disease Control as Director of Prevention Programs and Knowledge Management. In my department, I supervise the antimicrobial resistance program. I supervise the infection prevention and control program, as well as the risk communication program. I also head of research for the Nigeria Center for Disease Control, Research and Knowledge Management. I also oversee the Nigeria Field Epidemiology Training program. So data has been key to what we do at the Nigeria Center for Disease Control. My role, the summary of my role, is to ensure that there is evidence made available to guide the decisions of the organization, to position the organization as a scientific and learning organization that is evidence-based. I am also the national coordinator of the Nigeria COVID-19 Research Coalition, a coalition of researchers from research institutes, the academia, as well as policymakers, implementers, industry, private sector. So it is a coalition that utilizes the quadruple helix model. I'll be speaking more on that if I'm given the opportunity. It's really my pleasure to be part of this discussion and look forward to a very rich interaction. Thank you, and over to you.
Thanks so much, Chinwe, for joining us and for giving us an hour of your busy schedule here. So much appreciated as well. Over to you, Brennan.
Hi, everyone. Brennan Lake, joining you from Boston in the United States. I'm the VP of Research Partnerships and Data for Good at Cuebiq, which is a geospatial data and analytics platform. And through our Data for Good program, our mission is to improve lives through the novel use of mobility data, specifically in order to provide something of substantive value to the millions of users who entrust us with their data every day. As lead for this program, I work with organizations across academia, NGOs, multilaterals, and the public sector to provide aggregated mobility data for a number of different fields, including urban development, social equity, natural disaster response, and epidemiology as well.
Great. Thanks so much, Brennan. And over to you, Chris.
Thank you so much. And thank you for inviting me to join. So I'm Chris Wiggins. I split my time between Columbia and the New York Times. Briefly, I have been on the faculty for 20 years. Actually, that's where I am today. And at Columbia, my research is in applications of machine learning. My teaching includes teaching on the history and ethics of data, as well as applied classes in applied mathematics. I've had the pleasure of teaching some classes in data journalism over the years as well. And then for the last 8 years, I've been helping the New York Times build up a data science team, which focuses on developing and deploying machine learning, both for business and newsroom problems. So just to give a bit of the local sense of the New York Times is, I think, 4,700 employees with 1,700 in the newsroom and a far larger set of people sort of making sure that the newsroom remains strong and independent. So the team that I lead includes software engineers and people developing and deploying algorithms. And I'm lucky to have as colleagues a wide variety of teams on the newsroom side that have done a great job thinking about how to get their hands on and make sense of and narrate the world through data around this pandemic. Thanks very much.
Thanks so much, Chris. And thanks everyone for joining as well in the audience. And if anyone has a question, feel free to pose it in the chat so that we can either, anyway, if it's a question related to a topic that was discussed, I can call upon you to, or use the question to, anyway, deepen the conversation, but also we will have some time at the end here for a Q&A, so feel free to also type in the question. And if you have a particular question for a particular panelist, feel free to also anyway, make that clear. Now, over to you, Chinwe, to get us started. Obviously, data has played, as you already have alluded to in your own position, has played a tremendous role in actually understanding the virus, but also developing a response. And of course, a pandemic is not static, right? And it's basically a very dynamic environment where you first, anyway, try to understand what is the threat, and then try to develop, anyway, a response. And then now, anyway, of course, at the time when, as a result of massive medical science and pharma interventions, we now have vaccination, which is, of course, not always, anyway, equally distributed, but now we are, anyway, entering the recovery and the dissemination of vaccination stage as well. So a question to you, Chinwe, is what have you seen with regard to the role of data across the pandemic life cycle, right? And are there some, because obviously this is not your first time you start using data for public health, are there some unique features that you have seen that COVID-19 has illustrated with regard to how data can be used or should be used, or anyway, should never be used for moving forward? So over to you, Chinwe, with regard to your experiences.
So thanks again, Stefan. You couldn't have said that better. COVID-19 actually has really emphasized the importance of data in keeping us prepared against public health threats. We had, as a National Public Health Institute before now, started implementing a digitized surveillance system. We started especially after the Ebola outbreak of 2014. Prior to that time, we were using mostly the paper-based integrated disease surveillance and response system for reporting data, and that came with various challenges on, getting timely data to inform our response activity. So, shortly after the Ebola outbreak, we started working on a digitized surveillance platform called SURMAS. SURMAS is Surveillance Outbreak Response Management and Analytical System that enables real-time data reporting. We were quite slow in scaling SURMAS to all the parts of the country to enable us get information real-time from the various local government areas of the country because of limited resources. But with the coming of COVID-19, the detection of the first case in February 27, 2020, a lot happened, and we were able to deploy this same digital software to all the local government areas, 774 local government areas of the country, meaning that we are now able to get data from all the disease surveillance and notification officers real time, even at the national level. And not just at the national level, at the points of entry, we have this digital software, so they impute data using summers. We also have summers currently in the health facilities. So basically, the pandemic has given us this opportunity to improve on our data collection efforts, because how effective we are able to utilize data to guide our policies and decisions depend on the quality of data and how early and timely we're able to generate data. In the words of Dr. Tedros the DG of WHO, he said, infectious diseases are fast, but data can be even faster. So we need good quality data made readily available to decision makers to keep us ahead of a disease threat or an outbreak. So in the area of data collection, we have really advanced. Then secondly, we have also learned the importance of triangulation of data sources and data sets in making decisions. Data is not solitary. It's data of concerning a particular scenario, a particular disease, is situated within a context. And COVID-19 has also shown us that we need multiple data sets to have a holistic view and to make a holistic decision that will be more impactful. For instance, mobility data was used, even data from the aviation sector was utilized, and it guided us in our decisions around where we had a lot of mobility, especially during the lockdown, and how to even trace contacts. So these are all innovative areas that prior to now, we didn't really have that opportunity to expand on. So COVID-19 has helped us in that. And why that was possible is because we now have many sources of data. We've also understood the importance of social science data, not just quantitative data, being able to go to the communities, engage them in discussions, have focused group discussions, and collect data that will help us to understand their perception of such a new infectious disease threat like COVID-19. So that also came out very clearly to us during this outbreak. Also, the importance of data in the management of rumors. We have an event-based surveillance system that we utilize at the Nigeria Center for Disease Control, where we use a software called Dataflow to regularly scan social media networks and to understand what are those trending issues, and using keywords to identify discussions around possible events in any part of the country. That has helped our early warning system with signals that we usually escalate if there is a signal like discussions focusing on a mysterious death somewhere or increasing number of people coming ill in any part of the country. That is escalated to the surveillance team who now investigate, and that has really helped us in being on top of the game. So data in each cycle has been influenced a lot. Our data management processes with routine data quality assurance has also improved a lot, because that is the key problem we've had in the low to middle income countries, issue with data quality, because how good the decision we make with the data that we have is dependent on the quality of the data available to us and how accessible that data is. So we've gone a long way, and I really want to say that a lot of improvement has happened in the way we manage our data and in our collaboration for data management. Thank you.
Great. Thanks so much, Chinwe, for sharing your experience, and interesting to see that indeed, anyway, the arrival of the pandemic has led to an acceleration of some of the developments that were underway, but that ultimately have now anyway clearly established this kind of data infrastructure that allows for rapid and fast decision making, which is, I think, a really important point, is that it's not just about anyway having data. It's really about how do we how can we speed up the availability of data in order to also speed up the decision making. And that brings me to Brennan, because obviously the data that you have, Brennan, is actually, anyway, real-time data to a large extent. And you've been a pioneer even before the pandemic, of course, on really thinking about how do we, anyway, leverage that data for public interest objectives. And so if you could share a little bit, Brennan, what it is that you've been doing with the Data for Good program, and also, anyway, what has COVID-19 meant for your program, which of course already existed beforehand, but also, anyway, clearly had a massive impact on how you go about it, and also, anyway, what ultimately will what you will do moving forward as well.
Yeah, absolutely. Thank you, Stefan, and thanks, Dr. Ochu, as well for your insight. So as you pointed out, around the company's founding in 2016, we already began working in data stewardship, specifically through data philanthropy initiatives between Cuebiq and academic organizations for research initiatives, and multilaterals as well, like UNICEF and the World Bank. Most of these projects were related to fields, like I mentioned before, urban development, disaster response, and social equity. But fortunately, we were able to work on some epidemiological projects before COVID, specifically related to Zika, with organizations like the ISI Foundation in Italy and Northeastern Mobs Lab here in Boston in the US. So we had this foundation of being able to enter into responsible data sharing agreements. And we had some learnings about really what it took to work with partners in academia to help foster innovation in data science around mobility data. So with that foundation, when the pandemic hit, we were able to create a more collaborative structure rather than just one-off bilateral agreements. We created a COVID-19 data collaborative that consisted of things like a shared Slack channel so different researchers could collaborate, a single standardized licensing agreement that went beyond traditional governance principles to also add COVID-19 specific frameworks, privacy frameworks, talking about what data could and couldn't be used for in order to protect the privacy of the users who entrust us with their data. And then also we provided this single differentially private data set that multiple researchers could work on collaboratively. And as a result, by working with our own data scientists and the researchers that were part of this collaborative, we were able to start generating these aggregate metrics that we could publish publicly because they're incredibly privacy preserving. And as a result of that, we were able to start to answer some questions that policymakers that we had interacted with were asking, specifically related to how NPIs and social distancing have impacted mobility and other components of society. Questions like, how far are people traveling and how do people move between cities? How does income inequality and, income range affect people's ability to adhere to NPIs, non-pharmaceutical interventions, when, people have to continue to perform essential work and feed their children, right? Another question that a lot of people asked was, how is this impacting economic indicators? How does it impact visitation to small businesses and retail locations, which is actually, part of our core business commercially. So by co-developing these metrics with academic partners, we were able to provide something that was meaningful and actionable for policymakers, specifically at the city, state, and national level in the US, like, for example, City of Boston, the City of New York, which launched their own parallel data collaborative effort, and the CDC nationally as well.
Great, thanks, Brennan. And have you, of course, as I already mentioned, you're a pioneer and a leader in the space, but do you also see, because to a large extent you can, and as you know, we've had conversations about this in the past, is that this is like the new corporate social responsibility of the data age, right? Where those that have data actually, start also using it for public interest purposes beyond when it was collected, and of course in a privacy enhancing way. Do you see, do you feel that COVID-19 has established like a new normal around corporate social responsibility as relates to data? And how do you see your peer organizations engaging with you on learning how to do this well? So just wondering whether you also see, anyway, a broadening of actually the actors in the space.
Yeah, absolutely. I mean, I think that the pandemic in the data space, I can speak largely to the spatial data space, definitely has moved a lot of organizations towards embracing corporate social responsibility. I think that there may be somewhat of a dichotomy between organizations that embrace it more as a marketing or PR initiative to kind of share with a more wider audience how this data can be used. But what I find particularly meaningful and impactful is when organizations will actually integrate these programs, say like data for good type programs, into their core business activities. Because something that we've found is that, much more than just creating a simple halo effect, data for good programs actually create immense shared value for society, but also companies as well. So, these things aren't mutually exclusive in terms of how these programs can benefit both society and private companies. For us, for example, we've seen that the program has been able to deliver value to data suppliers, the app partners that we work with, and the individual users who know that the data being collected is being used for humanitarian and ethical purposes downstream. Internally, I think that we've seen the program add value for employees who can, work for a purpose-driven organization. And then finally, there has been immense value created for the general public through the fact that organizations, policymakers can make more data-driven decisions, right, that affect everyone's lives. Things like income inequality have effects on everyone's lives. Public health, as we've seen, in a huge way in the past couple of years, has had an effect on everyone's lives. I think another really interesting phenomenon that we've seen too, though, which was somewhat unanticipated, but I'll take credit for it, is that the Data for Good program, at least at Cuebiq, has somewhat served as an engine for innovation, where academic researchers and other research groups have kind of become the early adopters and lead users of what somewhat novel data set, right? And they've faced needs to use this type of data before the general market. And as a result, they're able to create tools and applications and methodologies and algorithms that, on one hand, benefit our commercial business, which helps our bottom line and helps make the program sustainable. But on the other hand, provides these open source tools for other researchers to use and for policymakers to use. So I think that my major takeaway, vis-a-vis CSR and the data space, what we've learned throughout COVID is that it's really essential that people think about these programs in a way that takes a holistic view towards value creation, both within the company and society at large.
Great, thanks so much, Brennan, and over to you, Chris. And obviously, the New York Times has become, anyway, like the beacon on how data is being used within the news sector. And of course, anyway, I'm sure you're behind this success and the achievement. But wondering, Chris, what have you seen with regard to the adoption of data or machine learning within a news organization such as the New York Times? And are there some lessons learned from COVID-19, both from the business side, right, how data is being used to actually respond to an economic environment that obviously, anyway, is challenging, but also from a reporting point of view, because I think New York Times for many has become the place to go to actually learn about COVID-19, as opposed to go to, for instance, a public official kind of website. And so that, of course, also increases the responsibility and accountability for the news organization as well as it relates to data. So any insights from you, Chris, on what has been the impact of COVID-19 on those two areas of anyway, the use of data or machine learning for that matter.
Yes, so that the applications of machine learning I can speak to a little bit more precisely. I definitely want to deflect, as we've discussed, any claim to credit for that, for a variety of reasons, including the fact that the project, right, to report on COVID-19 in a data-driven way was really represented by hundreds of people in the newsroom, of which I cannot claim credit at all. But I can speak to adaptation of machine learning and usage of machine learning, which has many different purposes. And sometimes machine learning is not the right tool for the right job. That's one thing to be clear. The newsroom in particular, I think, has done a great job by being one of the first newsrooms starting in March of 2020 to start releasing data in the open. So just putting data on GitHub from the get-go, the get-go being March of 2020 for many American publishers. And I think that's been, I mean, you can look on GitHub and see how the development community has built so much on top of that. It has included, one thing I want to come back to from earlier comments is the importance of triangulation and partnerships mentioned prominently by Dr. Ochu and by Brennan also. Triangulation, we all want data to be raw, and there's a sense that when data are raw, they are objective and more true. But for situations of any complexity, as you make the data more raw, you're constantly throwing away important context. So journalism, I think, is one great example about how you can, at the same time, eat your cake and have it too, is you can present raw data while being very upfront about how much work it was to produce those data. So, and eating your cake and having it too also means communicating the nuances of the data that are being presented, including the lack of high fidelity data that are sometimes available. An example that comes to mind is if you go to the New York Times map right now for looking at COVID, the state of Nebraska, which is a state in the United States, is just a huge gray zone, right? We don't have sufficient fidelity data from a state in the United States to include it among this tracking. In addition to very detailed reporting about complexities about the reliability of data come from different countries that were reported on in the editorial pages at the same time that the Upshot team and the graphics team from the New York Times newsroom were putting out these data. I'm sidestepping the machine learning issue, but I will say one thing about machine learning is most of the work that I do is deploying machine learning to try to understand the way people are engaging with content and how that relates to strategic and business goals of the New York Times. It is, I think, well known among people who develop and deploy machine learning that the world changes. And so in the case of a global crisis, any sort of correlative understanding of how people are engaging with the content and what that means for either strategy or business goals goes out the window, and you have to not just rely on data, in fact, but take a much more nuanced approach. So I guess on the subject of how data and journalism and machine learning relate to each other, I will say when it comes to journalism and trying to communicate the world through data, it's not as always clear that it is a machine learning problem. Often it is a real shoe leather problem, meaning getting your hands on the data, but also doing the research to understand what those data mean and communicating responsibly the data themselves, which do have an immediacy and a rawness to them, but also communicating to people in an honest way in what way those data were actually quite cooked. For the New York Times to produce, 3 or 4 GitHub updates a day of new data sets, that involves a team of hundreds of people to do that and to either scrape the data from different websites, to pre-process them different ways, to deal with the complexities of specific states or counties and data entry typos and things like that. It's very useful to have those data as a raw substrate on which people can make an understanding of the world. But the responsible thing to do is to communicate all the subjective design choices and all the shoe leather work, to use a reporting term, that goes into getting your hands on those data. And then just to amplify this point that Brennan made, that all of this really benefits from partnerships. The partnerships are important because it's a reality check on things. Any data source should be critiqued and treated as a potentially biased source, just like any human being has a potential bias source. And the more you have partnerships with different people, the more you can triangulate, to use Dr. Ochu's word, and to the veracity of your understanding of the world. But also for something like COVID, it's deeply, deeply complex, right? So the case count alone is certainly not telling the whole story. As one example, in the early days, nobody was testing. So the number of cases meant something different than it did when testing became more prevalent. And so it is wise to look not only at cases, but mask usage and vaccine acceptance and doctor visits. All of those sources of data are incredibly useful, but you can't do those unless you have some partnerships and some creativity. So I guess those are the points I wanted to make, is that going from 0 to 1 in terms of not having data rather than having data is an important transition, but data are not to be trusted any more than any other source when it comes to journalism. And so it really requires partnership and nuance and responsibly communicating that, in addition to simply, it's not just a matter of just putting a data set on a GitHub repository. There's a lot of reporting and critique and partnership included in order to narrate those complexities.
Thanks so much, Chris. And this has already been a very rich conversation. And so anyway, there are multiple ways to actually deepen this and take it. And feel free to put any questions that you might have in the chat. But Chinwe, I do want to pick up where Chris left as well with regard to partnerships and wondering. So imagine that you could say, Chinwe, here's your magic wand. What would you like, anyway, Brennan and Chris to do for you tomorrow? So in terms of, of course, as representatives of particular kind of sectors, right? And so what would be, Chinwe, what would be a way to strengthen partnerships with both, on the one hand, the private sector that has a lot of, data that could be relevant and useful for public health decision-making, but also the the media sector that obviously has a critical role to play, not only now as a key data partner, but also in actually communicating, as Chris was saying, the fidelity, the challenges of actually the data, but also the signal that needs to be conveyed. So, Chinwe, what would be, how would you want to strengthen that?
Thanks again, Stefan. And just to also emphasize what Chris said, the importance of communication, being able to communicate. And now, for COVID has also shown us that for an infectious disease threat that is driven by behavior, so to say, a lot depends on our ability to communicate data in the way that everyone understands, not just the public, the policymakers, but also the people that need to adapt to a behavior that can slow down the transmission of the virus. And that has really further buttressed the importance of community engagement and community partnership. One key thing that we as a country have also experienced that has helped us and strengthened the way we use data for decision making is the platform that we brought together that has enabled this form of collaboration between the academia and the policymakers themselves, as well as those in the industry and the end users, who are the people that we target when we are doing research. We have the Nigeria COVID-19 Research Coalition, which is a very important model that has enabled this kind of partnership where policymakers themselves are part of the data generation process. So it's not just maybe those in the academia generating and then publishing in scientific journals, but rather receiving the research questions from the policymakers. What are those areas of interest? What are the burning issues you would like to address? And then bringing in the technical expertise in developing research methodologies, and also getting the perspective of the end users. For instance, COVID-19 survivors, they're also part of this platform. So it is a very rich partnership that has helped in providing a more detailed understanding, in-depth understanding of this very complex phenomenon called the COVID-19 pandemic. And also the social science aspects. In that platform, in the coalition, we have social scientists that also help us to understand what is going on in the community and what is the true impact of COVID-19. Look at the various aspects, the economic aspect, like Brennan mentioned, and so many other issues around COVID-19. I really want to bring the example of what we are doing currently under the sponsorship of AFD with Expertise France and the GovLab here. We've been able to go back to most of the non-conventional data sets that were collected at various phases of the outbreak through telephone interviews and online polls. So we are now triangulating all those data sets to understand what drives people's behavior. Firstly, we want to know the risk perception. Has there been any change in risk perception? In Nigeria, we've had 2 clear waves of the outbreak. We're currently, still at the beginning of a 3rd wave. So what has there been any difference in risk perceptions? What is the role of trust in people, even when you have the evidence and you're showing to people? What role does trust have to play in letting people really take your advice, evidence-based advice and guidelines? So these are really very, very key and very important issues. To communicate effectively, we need participation. Participation of all the relevant stakeholders, especially community participation, even in defining the questions that really bother them and identifying solutions to that problem. So this is a key lesson that has really stood out for us as policymakers and has really changed the trajectory of our public health response, that now we allow the community, the public, to drive their own public health response by providing guidelines, engaging them, and trying to understand how they feel. Every week at the initial phase of the outbreak, we were carrying out regular polls from the public. So, Stefaan, so as not to drag this further, partnerships must be very, very robust and extensive. Everyone has a role to play. The academia, the policymakers, those in the industry, and then, of course, the beneficiaries. All these ones must partner to provide a holistic view on how to really manage such a complex situation as a COVID-19 pandemic or any pandemic.
Great. Brennan, you wanted to, I saw your hand raised, so you wanted to intervene as well?
Sure, yeah, I'm seeing that time is tight and I would love to hear from the audience as well, but something that came to mind, Chris, when you mentioned the need to, critique and scrutinize the data that you may be using, and Chinwe as well, when you're talking about the decision-making process and the communication process between different stakeholders, a hypothesis that I have is that if there's a new, somewhat novel data set, if it starts to appear in the scholarly literature where there are opportunities to say, to kind of have a peer-reviewed source for saying, hey, is this data representative? Hey, is it okay to use data for this purpose, but not that purpose? Where is this better suited and maybe not so helpful? Do you find that type of phenomenon helpful in the decision-making process to get kind of a neutral third-party check on things like, representativeness, quality, and so forth? And I suppose that's both to you, Dr. Ochu and Dr. Wiggins.
Maybe I'll take a kick at it. Absolutely, Brennan. The importance of quality checks on data, like I said before, the decision you can take based on any data set depends on the validity of that data. So it's important to carry out regular audits And in the little exercise that we have done, bringing together different kinds of data sets to look at them, I could see that validity check, that quality check, that one data set can provide for another, because most of these data are collected using different methodologies and different settings. So it is important that we don't interpret data in isolation, but that rather we consider all the contextual issues using other non-conventional data to interpret our conventional data. So very, very, very important in assuring data quality. Over.
Yes, I would concur that in general truth making in general benefits from consensus and checking many complementary sources. This is the same rules for science as in journalism. But I also wanted to amplify something Brennan said. It sounded like you might have said the word should, something about what these data sets should be used for. So I wanted to call out particularly data about people. Absolutely, there's a lot to be thought about, including in academic literature for distributing data sets. There's famous examples over the last 20 years, for example, around social network data that were not collected with consent, and in some cases were actually taken down from academic publications because of that. So there's informed consent, but there's also privacy, and Brennan sort of glossed over briefly his use of their use of differential privacy, which is also now a technical standard for the US Census Department. So as we are distributing data about people, one of the things we need to think about is how granular is fair, and how granular is appropriate level of privacy, and what are the technical tools we can exploit, including differential privacy, which Cuebiq and Brennan and others, including the US Census, have exploited to make it possible for us to present data in a way that's responsible and protects the privacy of the individuals. So I just think particularly when we're talking about data about people, there is a lot to be thought about in terms of the consent of the people whose data were being collected, and responsible privacy in a way that balances analyses that people will want to do, but also the consent of the people whose data are represented.
Yeah, no, thanks, Chris, for bringing that into the conversation, which relates to this whole issue of, anyway, how do you get the social license to actually reuse the data for other purposes than initially intended, right? And so consent is one way, or anyway, you can go through some privacy enhancing techniques as well. But I think what I think Chinwe was referring to, which I think is very powerful, is this kind of community, kind of like an assembly kind of way to actually get that social license to also think about what should the data be used for, and how do we then make sure that this is trusted as well. But one question, and I'm sensitive, we only have like 6 minutes left, and this is a conversation that I would love to have, by the way, for a much longer period of time, because all three here, you have so much to bring to the table. But coming back, Chris, and actually this is for all of you, meaning when I have conversations, especially around big data and new data for policy making, I think one realization that COVID-19 also has made is the importance of small data, and the fact that big data needs to be combined with small context-specific data. And so wonder, especially given the fact that this is the opening plenary, and I think it might be something for this whole conference to reflect on, right? So what is, the importance of big data versus small data? And more importantly, what I hear you all say is that it's not either or, it's really about shared data that we should focus on. And wondering, whether any of you may want to reflect on this distinction between small and big data, and how COVID has actually illustrated the importance of both, or the limitations of both as well. Chinwe or Chris, do you want to start? Yeah.
I mean, historically, I would just say this reminds me of John Snow's epidemiological work on cholera. The lessons to be learned include domain expertise, shoe leather. And then in the modern age, I think particularly in STS communities for a decade or more, people have been pointing out that big data is not complete data. So you can have a lot of data about something, but if the data are systematically misrepresented or misreported, doesn't really help you to have lots of it. And instead, actual domain expertise, shoe leather, and often partnerships are really most valuable. Sometimes small data is the best data.
Okay. So if I can add to that, I think it's really, really important that we improve data interconnectedness, whether it's big or large data or small data. A good case at hand is what we have at the NCDC, where we have the large data coming in from our routine surveillance epidemiological data using that big SOMAS platform. But we also have this small data where people call in our Connect Center, reporting issues. And these are ordinarily what we would just use to respond without really linking it to the larger data. So, but with this outbreak, we've been able to improve the connectedness between that small data source with a larger data set. And then that has also improved the kind of interpretation we give to our large data. So it is really, really important that we look beyond the conventional data platform, and that we also come up with a way of improving this connectivity of data, harmonizing data. Now, most of the infectious disease threats we have are zoonotic. So how do we improve or harmonize data across sectors? Human health, animal health, environment sector. How do can we have, I'll really be happy to get this answer from this conference. How do we ensure that we have a platform that brings together these data from these various sectors and make them readily visible and interpretable in a way that policymakers can easily and very fast appreciate and visualize this data to drive their policy making and their decision-making process. Very, very key to us, and I really look forward to innovations that will address that.
Great, thanks so much. And yeah, I totally agree with you, Chinwe, is the importance of focusing on One Health across and not have the stovepipes of disciplines even limit the perspective of stovepipes of data for that matter as well. Brennan, I give you the last word here because I'm sensitive to time, and we are we're having a lot of panels following this opening plenary. But any reflections from your end, Brennan, on this whole question of big versus small versus shared, and especially what Chinwe was referring to, the importance of interconnectedness across the data sets and the perspectives.
Yeah, absolutely. We are a big data company, so I think we know our limitations. Early on in the pandemic, interestingly, one of our data scientists, who's also a social scientist, Alex Ruiz-Euler, had an insight by looking at the data that, those from poorer communities stayed at home less and traveled more than those in wealthier communities. But we had no ground truth, right? By working with the Times and researchers at the Times, they were actually able to go out and interview people from different communities and see some validation that this was indeed the case, right? There was not only a big data story, but a human story with context around people who could work from home, who couldn't work from home, and things from that nature. So I think it's a matter of knowing our limitations and finding those who have the capability and expertise to combine the small data, the qualitative data in a meaningful way.
Great. Wonderful. Chinwe, Chris, Brennan, thanks so much for sharing your wisdom. This I couldn't think of a better opening plenary to set the stage for the remaining 3 days. I think we covered a ton, emphasis on partnership, holistic data sets, innovation, and how we go about using non-traditional and traditional data sets, and more importantly, doing so in a way that is trusted. And I think we have some really foundational insights here that we can build upon for the next 3 days. So thanks so much. And over to you, Emily or Zeynep. I don't know how we move to the next panel, or whether we should leave all and then rejoin. I think that's probably not the purpose, but over to you.